This was special. This was extraordinary because it was about a staggering number of children that are very needy, very worthy, and the return on the investment for me was obviously very high. My experience is not different than a lot of people in San Diego. Everybody's been to Mexico. We've all seen the good and the bad, and there certainly is a whole lot of poverty. Perhaps the thing that's not obvious to a lot of people is the number of children that are raised in absolute abject poverty. The kids that just never have access to health care. They never see docs, they never see dentists, they never get their eyes checked. It's almost a birthright in America, if in fact it's not. When you see all the poverty in Mexico and you see how grinding it is for many people, it's easy not to think about children. Children need more help, as near as I can tell, than anybody else. You know, as adults, we like to, we all take pride in the fact that we're here for children first, last, and always. My concern as a donor was to make sure that when I gave money, that it was going to be well used. If I decide that I want to give $100 or $1,000 or $10,000 or $100,000 away, okay, once I make that decision, the money isn't mine. All right. I'm merely almost a fiduciary, a trustee, and I have to find the highest and best use. I decided for my own selfish reasons, frankly, that the highest and best use for some money was to go across the border, because the return on the investment was just overwhelming. The hospital is an extraordinary place, and it's a wonderful concept to provide some kind of preventive health care. It's perhaps difficult to measure on a child-by-child basis, but the law of large numbers says you can change a lot of people's lives for the better. There must be such huge rewards for being a practicing physician, especially with indigents, that it just doesn't make any sense to those of us that frankly are not capable of doing that. I don't know how they do it. They can do exams on kids, they can deal with dental problems, deal with the sort of medical stuff that is routine. The hospital's done obviously good work, and I think the challenge is to continue the progress and move forward. I'd like to see more people involved on both sides of the borders. I'd like to think that people would see this as a safe place to put their money to work, that they would understand that it has an enormous impact on children who are otherwise outside the healthcare system. I don't think you get the same kind of reward that you get from seeing your name in a program or a piece of real estate, but the rewards from looking at kids or seeing what Betty's done and what other people have done is overwhelming. I haven't seen many things like that give me that good feeling elsewhere.